Tracheal stenosis in kids, especially with complete tracheal rings, is quite a complex issue. Have you come
Yeah,
across that?
I have, but why are those complete rings such a big problem?
Well, they cause significant airway narrowing, and often these kids have heart defects or lung issues, which
Right.
complicates things even more.
So it's not just the airway we're worried about then?
Exactly. It's like trying to fix a bent straw that's also leaking at the same time.
Yeah,
Multiple problems to tackle.
that's a tricky situation. So what's the best way to treat this?
Slide tracheoplasty is the gold standard now. It essentially doubles the airway diameter by sliding the tracheal segments over each other. It's
Hmm.
pretty ingenious.
But aren't surgeries on such tiny airways risky?
Absolutely, but with careful planning and preoperative optimization, the outcomes are usually positive. It's
Right.
all about teamwork.
What does that optimization involve?
It includes thorough diagnostics, managing infections, and ensuring the child is stable before surgery. Every
Yeah,
detail matters.
makes sense. But what about tracheomalacia? Is that related?
Well, tracheomalacia is when the airway collapses due to weakness, not narrowing from rings. So treatments are different, focusing on supporting the airway.
Ah, got it. But sometimes they can be confused, can't they?
Exactly. That's why accurate diagnosis with bronchoscopy is so crucial.
Yep.
We need to know what we're dealing with.
You mentioned infections earlier. How do they impact surgery?
Infections like MRSA can complicate healing, so we screen and treat them before surgery. It's better to be
Right.
safe.
But don't you think sometimes we rely too much on surgery?
Well, in some mild cases, observation is enough. But for severe stenosis, surgery is often necessary to save
Yeah,
lives. It's all about the individual case.
fair point. So early detection is key then?
Absolutely. The sooner we diagnose and plan, the better the outcomes for the child.
Hmm.
Time is critical.
It's amazing how much goes into treating these conditions.
It really is. But seeing a child breathe easier makes it all worth it.
Definitely. Thanks for sharing all this. It's been enlightening.
Anytime. Always happy to talk about ways we can improve patient care.